Beautiful. So once again, this is the UC Berkeley online MPH information session, specifically focusing on our interdisciplinary program. Great. So my name is Elise Rudolph. I'm the Director of Online Recruitment and Admissions, and I'm joined by my wonderful colleague, Stephanie. Would you like to introduce yourself?
Hi, thank you so much, everyone, for joining us on the call today. Really excited to share what our program is all about, and thank you for being here.
Thank you, Stephanie. And our next guest of honor is Dr. Evan van-Dommelen-Gonzalez, who is one of the faculty in our program and also the co-lead for the online MPH program. Additionally, she is the program lead for our interdisciplinary program. Evan's research interests include community organizing and participatory research approaches, place health and social networks, mixed method research, intersections of young adult health and social environments, immigrant community health, and worker justice. And you'll see on the screen some of the courses that Evan teaches, both in our online program and in the DRPH program. So Evan, would you like to share a little bit more about who you are?
Thank you so much and welcome everyone. Thank you for being here today. So I'm Evan van-Dommelen-Gonzalez. I use she, her pronouns. And Elise just gave a really nice introduction sort of about my areas of work and research. I've been teaching in this I like to refer to myself as a teacher learner and really approach teaching in the program and think about our program faculty culture in that way as well since 2014. So I've really watched the evolution of the program, and I'll share a bit more about the interdisciplinary program in particular and sort of how I integrate many of the areas in which I work, thinking in terms of participatory approaches, thinking about the social determinants of health, the way in which context shapes communities. All of that is actually directly interwoven into how the program operates and also how I advise. So yeah, I've not only had the opportunity to really see this program grow over time in terms of courses, in terms of faculty, in terms of concentrations. At the very beginning, we were just interdisciplinary and health policy and management, and now we have 4 different program options. Interdisciplinary consistently has been proportionally speaking, the largest. And I have some thoughts about why that is and can share those down the road. But one of the most exciting things is health and social behavior is the very first course that students take in the program. And so I have the opportunity of meeting students in their first term. So that's very, very exciting. So I'll pause there.
Thank you so much, Evan, and thank you for joining us today. Our next guest is the wonderful Marcela. So thank you so much for being here, Marcela. Marcela Mobadi is a first-generation Latina immigrant and current student in our program. I didn't mention that. So Marcela is a current student in our online MPH. She is a doctor of dental surgery and an MPH student hailing from Nicaragua. She is also an exemplary picture of what our program hopes to uplift, a change maker whose aspirations are centered around improving the health of the Latinx community and empowering the next generation of Latinx healthcare providers. With a dual background in clinical and non-clinical healthcare, Marcela brings experience addressing social determinants of health through community engagement, culturally responsive care, and advocacy that strengthens systems of care. Furthermore, she's especially committed to advancing equitable health opportunities by fostering inclusive partnership and championing education as a key social determinant of health. So thank you, Marcela, for joining us. Would you like to say hi to everyone?
Hi, good afternoon, everyone. Thank you so much, Alice, for the introduction. And it is a pleasure to be here and meeting all of you prospective students. And I have also the pleasure to be in the interdisciplinary concentration. And Dr. Evan is as Alice mentioned, the director. And I love this concentration, and I am excited about sharing my experience with all of you. Thank you.
Thank you so much, Marcela. We're excited to hear more from you. So today we're going to talk a little bit about the mission, vision, and values of our online MPH program. We'll talk about the design, so going over some of the curriculum and timelines, special features like our summer visit. And then we'll really dive into the interdisciplinary program. We'll look at a sample curriculum. You'll hear from Evan and Marcella. We'll talk about logistics, program fees, and scholarships available, the admissions process, and then again, we'll have time for Q&A at the end. All right, so here at UC Berkeley Online MPH, our mission is healthy people locally and globally. And there is a bit of writing on this screen, but essentially what I like to share is that the online MPH is really the same curriculum that we offer in our on-campus MPH program. It's taught by the same faculty. This is a high-quality UC Berkeley education. And we believe that this education should be available and accessible to folks who might be working full-time, because we believe that that adds valuable experiences that can be used in the classroom and add to our learning community. It might be those who have other responsibilities like caregiving responsibilities, or folks who either don't want to relocate to the Bay Area or can't relocate to the Bay Area. So, this is really, again, a high quality UC Berkeley education taught by UC Berkeley faculty and made accessible through an online modality to folks who are working full-time or have other outside responsibilities. So we're really proud to offer this MPH degree in the online format. And we believe that you continuing to work in your place of work, continuing to work in the communities that you're already members of, is advancing this goal of healthy people locally and globally. Our values here at UC Berkeley Online MPH are service in community, showing up with authenticity, growth rooted in justice and equity, cultivating connection through learning, and centering wellness. And I just want to pause here and invite Evan, who's again, co-director of the Online MPH and someone who's been a part of the Online MPH for a number of years. Would you like to share sort of your perspective on how these values show up in the Online MPH?
Thank you, Elise. Sure. I mean, I think these values in our mission is, again, it shows up in our curriculum. It shows up in how we approach our work with students. It's a very high touch program in that respect. But I think fundamentally, and this really comes from my own mentors in public health, that this is a social change profession. And that means coming to this space. This is about thinking driven oftentimes by our lived experience that really shapes the passions we have around public health. This comes out in applications. We see this very clearly, sort of the community issues that folks are most passionate about. And then the ability to have a almost living curriculum in which students are thinking about how they're applying their learning in real time. And so even in our courses, students are able to lift out projects that they're working on and use them in their own workspaces or to impact change or secure funding for programming in their own community. It is a highly collegial learning environment, meaning that we learn from each other, and there's opportunities in courses to reflect on your learning and how it is directly helping you think about your current work situation or perhaps a future professional opportunity. We know that this work is about that. While we're doing the connection through learning, it's really the idea is how are we taking the frameworks, the skills, the content we're learning and creating those connections locally in our communities. And so there's ample opportunity to think about that. And then showing up with authenticity. There really just isn't, I think in this space, in order to partner with communities and work with folks on what they believe is the most important issues and come to the table with your tools as a public health and social change professional, that in and of itself, it really comes from that space of justice and equity. And that is a cornerstone of this work, thinking about really serving communities, meeting folks where they are, supporting our community members who may be most vulnerable or disproportionately impacted by systems and structures. And so I think in that way, we really do we want to see the full you in the program because we think that that actually helps people to be present in their work in working with communities.
Thank you so much, Evan. And I'm going to turn it over to Stephanie to give an overview of the online MPH.
Thank you so much. And feel free to chime in, y'all, if there's anything else to add on this slide. There's lots to say. But essentially, our program is offered 90% online, asynchronously. We are a 7-semester program, and we have a 10% component, which requires 2 mandatory summer campus visits. So we actually have a slide coming up that will highlight what this looks like. But essentially, there will be a lot of flexibility within our program. So the type of degree that you would receive is a professional MPH degree. Something that I like to acknowledge is that our degree does not indicate that the program was completed online. This is a popular question that I receive, but you are public health professionals doing the work, coming to bring in your skill sets from all different spaces, and that is recognized through our CEF accreditation. So it's a professional MPH degree. The course delivery that is set up is that the lecture materials are provided asynchronously, as I mentioned. So that means that it's not live, and there are weekly deadlines. So we have a cohort model where there are students working on assignments at the same time, and office hours are held in real time. I would like to add, though, that while the lecture materials are not necessarily live, there are many opportunities in some of your classes where you will have an opportunity to meet with each other through synchronous sessions. And Evan may actually highlight one of her classes where you have this opportunity in a moment. But the course material, or the course model in itself, is that first year of your program would be on a fixed schedule. This means that students are required to complete 6 pre-assigned core and breadth classes. So it's very seamless coming into the program as a first year because there are classes that are already set up for you. You just have to enroll in it, and we will let you know which classes they are. Within the second year, this is where you are taking more classes that are around your concentration, more classes around or your elective courses, and there is different classes that you will be inspired to take and will be able to map out with your student services team. In doing so, the student services support are going to be primarily your program manager and your faculty advisor for academic and program support. The average time commitment within our program is, as mentioned, a part-time program, so 15 to 17 hours weekly, and this is including all of your studies and your academic materials for the week. And your average units enrolled per semester are typically 6 units, so that means it's going to typically come out to 2 classes over a period of 7 semesters. The units required to graduate are also a minimum of 42 units. And our capstone is a comprehensive examination, and it's open book. So there is a lot of opportunity for you to take in all of the things that you have learned throughout the program, and we will close out with the comprehensive exam before graduation. So that's just to highlight a bit about what the program design looks like, but we can totally answer questions in the Q&A about this. But before moving on to the next slide, going back into the synchronous session, Evan, would it be possible for you to highlight what your class looks like? As I feel like it's a very engaging style of course.
Thank you, Stephanie. Marcella can certainly speak to also the experiences in the classroom. But what we do is, as Stephanie shared, our program is asynchronous, but it's not self-paced. So you're moving through your class with access to all the required materials, 7 days a week, 24 hours a day, and you're able to engage and submit assignments and participate in discussion forums. But it's not self-paced in the sense that there are weekly deliverables. And so there's weekly office hours you can come into. Those are synchronous. And then we do have on Thursday evenings, we have they're optional, but we encourage people to come at least once. Some people come every Thursday, where we have a live discussion through Zoom of the week's topics. And then we have group check-ins. A lot of the courses involve project groups where you're coordinating with colleagues. It's a really great way to meet folks who are coming from a range of different professions. Many people who are in groups in their first year, actually, I work with students for the comprehensive exam and preparing, and at the end, they're actually studying with the same folks that they met in their first year, or have gone to a different events, weddings, other types of social events as well. But yeah, so there are these options throughout the week, both in terms of office hours and discussions and mini courses, to have the ability to connect with people in real time, in addition to your small group experiences. So I'll leave it there. Okay.
We got lots to cover, so thank you for highlighting that.
Yes, thank you so much. And that's a great segue into another very fun aspect of our program, which are the required summer visits. So Marcella could certainly talk more about this in a moment, but essentially what these are is, though we are an online program, we describe ourselves, as Stephanie mentioned, as being 90% online. And that's because each summer, over the course of the 27-month program, you'll come to campus. So you'll come to campus a total of 2 times. We bring all of our online students together for usually around 5 to 7 days to do an immersive conference style experience. We bring in guest lecturers or guest speakers. The faculty will lecture in person during this week. We build in networking opportunities, social opportunities. You can have lunch with faculty. It tends to be a highlight for our students of their time in the program. And so with that, I wanted to ask Marcella, do you have any fun memories from one of your on-campus visits that you'd like to share with the group?
Yeah, thank you, Liz. So yeah, I mean, it was very special to meet in person with all my colleagues in the same program, and meeting in person with faculty, with staff. It was incredible, memorable to feel so welcome in a school. And yeah, and continue developing friendships. I have made good friends in the program, and also learning from one another and from our different experiences in public health, our different backgrounds, in the open discussions, also in the classroom. It was very interesting to also ask questions directly to faculty and decide about the elective courses, because there are so many amazing classes that sometimes it gets very challenging to choose from. But yeah, I mean, I think all those elements and experiences made it very special, the time during the summer visit. And also because it's a very close-knit community, and you really feel it. I mean, right now we're telling you, but when you get into the program, you're gonna really have that beautiful experience. And even online, all the activities and the way the classes are implemented, it makes you feel like you are making a big difference, and why you are in public health in the first place. Yeah.
Thank you so much, Marcella.
You're welcome.
Wonderful. So I'll hand it back to Stephanie to kind of get into some of the details about the timeline of the program.
Thank you so much. So within our program, as I mentioned, traditionally we are a 27-month part-time program. So without making any changes to your schedule, this would be the first role. You are taking 2 courses over a period of 7 semesters. But as you can see here, there are some blue options here. And what does that mean? So essentially, for your first 2 terms, the courses follow a 15-week full-term structure. So this schedule just allows you to adjust to your graduate program. It allows you to really understand the online learning format and balance your work schedule. It's a very critical time of transition, and we recognize that. So it gives you an opportunity to really take in this exciting time, but at a good pace, right? And moving on into your third semester, so from summer term thereafter, you'll follow, the courses would shift over to a more accelerated 6 to 8 week format. So within the same semester, the classes are approximately 6 to 8 weeks of instruction. And that's 2 classes a semester, so no changes there, but it just means that the courses are taken consecutively, meaning one class at a time in a shorter, more focused session. So before you complete one class, you will have to go through the 6 to 8 week period and then take your second course thereafter, and that concludes a semester. And then the second row here is really there's 2 different additional pathways for students outside of the traditional format. So if you're interested in perhaps accelerating your time with us and completing the program within 2 years, then you have the option of taking now 9 units, which totals out to 3 classes in your second year of the program, if this is an option that works within your schedule and something that can be agreed upon with student services. So this is another consideration that you can take if you are hoping to finish a little bit sooner, but that's the earliest that our program can accelerate your timeline. And the last pathway is if you need to take a pause. So in some cases, life happens and you may be in a time period where it's beneficial for you to take a pause, and our program allows you to complete the program generally up to 5 years, but most students may delay their pathway up to like 3 years or so. But these are different pathways that are offered to our students, and we encourage you to reach out to our student services team, primarily the program managers, should you ever see yourself at a point where you want to explore different options. And with that said, I find that most of our students follow the traditional pathway, but as you go through the program, you'll know what's favorable for you. And again, it's a flexible pathway for you. And is there anything else to add, Ra? I don't think so. Yeah, let's go ahead and move forth to the next slide.
All right. Well, I just want to say, and I think hopefully Stephanie helped to lift this up, and also Marcela's comments, but that flexibility is a really big part of our program. We realize folks are balancing community, they're balancing work, family, all of these different commitments. All of that experience enriches our own learning experience in the courses and in the program, but it also means you're balancing a lot. And so that is an understanding that we hold as a program, that our advising team, our faculty hold, and so recognizing that there is this flexibility built in. There's the ability for students to take breaks, to kind of tailor their time with us. So I'm going to talk specifically about the interdisciplinary program. We don't call it a concentration because by nature it's exactly not that, right? It's a program. So concentrations, and we offer different concentrations, they're very structured course maps. So you're taking required courses in a sequence oftentimes. For interdisciplinary students, it's a very tailored course map. And so what you're thinking about here is oftentimes students are coming in with a wealth of experience already, and they may have a sense of like, okay, these are my learning and professional goals. These are the areas that I want to gain more experience in, and we kind of plan backwards. What is the toolbox that you want to walk away with? What does that look like? What do you want in terms of content areas, frameworks, methods, all those types of things? So really think about who you're going to be when you show up in your community and you're at the table with folks from, all different spaces, including community members, and you're saying, these are the tools I can contribute to addressing this public health issue. And so we have students that come in that are really kind of oftentimes in different places in their career. I think so we have some folks who are earlier, some who are mid-career, others are mid to late career. And so the ability to tailor your course map can be it's a nice way to be able to really align where you're moving next in terms of aligning your professional and learning goals. So for folks who are really not thinking about actually changing their current profession, they're really here to maybe transform and enhance. So we have medical providers in our program who may want to, shift how they're conducting patient care and bring in a population health or lens, or bring in ways to contextualize their patient's experience, thinking about the social or structural determinants of health that are impacting their health outcomes. And so this way you can really think about what are the tools I need to transform in my current professional space. Other folks are coming into this space because they're pivoting into a public health career. They've maybe worked in a space that they feel is adjacent. I will say, when it comes to social determinants of health, I feel like everything is, if you're in education, if you're in law, if you're in tech, if you're all of these different spaces, they're all part of what contribute to the health of communities. And so there's oftentimes skills that are very clearly transferable into public health. And so this is a space where students are thinking about, okay, this is where I'm coming in with, this is where I want to go. It's pretty different from what I was doing before, but how do I make this work? And so that I walk out with the skills that I need for this next step. And then there are folks who are more maybe in this position where they're ready to figure out how they can advance. They're going to move from a research assistant to a program coordinator, or any other, different types of upward mobility. And they oftentimes may even have support from their employer, but they really need this degree for career advancement. And so they're thinking about, what is it for this next position that I need? How do I want to tailor my course map in order to be able to meet those requirements or these other responsibilities that I'll take on after I receive my degree and get this promotion? The interdisciplinary program allows you to really think about how you combine courses from the different focus areas we have. So you might want to take the courses from our community health sciences or CHS courses, and then take some of the epibiostats to kind of to marry this social epidemiology space. You might pull from global health, but you also want some of the management skills, maybe health management skills and strategic planning. So pull from our global health course series and pull in some of those management courses. You might want to have community health sciences and take the policy courses. You might take some of the health and social programming, like the program planning or evaluation or survey design, but then you also want to have the policy advocacy and the policy methods courses. So there's ways to do that. And so you're really pulling from different areas. In general, the interdisciplinary program kind of consistently asks this question: who needs to be invited to the table? Oftentimes, public health issues are complex. Sometimes they feel seemingly intractable, like how are we going to dismantle or sort of unlearn and dismantle these different factors that may be creating burdens for communities. And so this idea of an interdisciplinary approach or orientation allows us to always ask that question: who needs to be here and be in this conversation? How do we form interdisciplinary teams so that we can really bring in the strengths and talents and gifts and tools from a range of different areas? And so it can be even within public health, we have different fields. And so we already kind of hold that, but this is an orientation in terms of also how we approach the course mapping in this option. And the other thing, which I think is really helpful for folks, because this is one of my favorite parts about being a teacher learner in this program, and it's quite different from our other sort of residential options, is that students can select courses each term to map to real-time needs. So for instance, I was advising with a student recently who has an opportunity to conduct an evaluation. They've worked with another program, and they have been, working in one space, and they're really thinking that's going to happen in the spring. And so we talked about what courses will help them to be able to be successful and carry out and apply their learning in real time. And so because you're not sort of, there's the option of planning each semester what you're going to take the following semester, you can really take advantage of the ability, this nimbleness, to be able to pick up courses that make the most sense for you in terms of where you're going next with your career and sort of what's coming up on your radar, or an opportunity that you want to take advantage of. And so I think I will pause there.
Yeah, well, on the topic of this, thank you so much for sharing that. I think it really captures what the interdisciplinary space looks like. And while we have Marcella on the call, we'd love to know, what drew you as a student to the interdisciplinary space.
Thank you, Stephanie. Well, coming from a dental background, I wanted to learn and understand how the social determinants of health impact oral health. So, and also how the broader health systems, such as policy, health management, and even, the skills in leadership. So I really wanted to understand how all these pieces work together to improve the health of our communities in a holistic approach. And also, as Dr. Evan was saying, like this program offers a lot of flexibility in how we can also tailor and select the courses based on our long-term or professional goals or the work that we are actually are doing in public health, and to seek, innovative solutions to solve pressing issues that we face in our communities in public health. Yeah, so basically that's what drew me to this program.
Thank you.
All right, and I think this is me again. So this is an example. Some of the courses, as Stephanie mentioned, are the required core and breadth courses that introduce students to the different fields of public health in their first year. But this is just a way to kind of think about course mapping. And again, there's a lot of flexibility within the interdisciplinary program, but you'll see there is in the full semester, you have health and social behavior and your EPI methods. And so we have those two courses you're taking together full term. And then you will do the same thing in the spring term. You'll take environmental health sciences and the probability and statistics courses. And it's really interesting as you're taking these courses, you can think about how the courses talk to each other, how the different fields talk to each other, and why you might have a team of pulling people in who are policy, pulling people in from environmental health, and sort of all of those different pieces. And then in the first part of summer, this is when many students begin the half-term courses, and we do have courses in fall, spring, and summer. Students in their first year take their final required breadth course, which is the Introduction to Health Policy and Management. And then in summer too is where there's the opportunity to start to explore kind of the summer right before heading into your second year. To start to think about, okay, now I have the opportunity to pick courses that I really want. And hopefully during this time in that first year, as you're moving through courses, a lot of times being open to the different fields, even if you come in with a clear sense of what you think you want to take or where you think you want to move, being open to kind of absorbing and questioning sort of those goals, and maybe perhaps even thinking maybe I'll take a course I hadn't planned on taking based on my experience in this course. And of course we're you have advising to support and be we're here to be thought partners with you in that process. But these courses in blue that are highlighted here, these have been recommended over time in the interdisciplinary program. So the program planning, evaluation, and survey methods, because these courses kind of cover fundamental and foundational areas in which public health has leaned into over time, really to design public health programs, evaluate their impact or their process, and then really what are the tools that we collect using survey data, different types of survey data and mixed methods, in order to really collect data to be able to understand health issues, but also evaluate the programs and the interventions we design. However, there was a time when these were required, but they're no longer. They're recommended because there's a lot of options you can choose from. The curriculum has grown substantially over the last 10 years. And so when you start fall, you've got elective choices, and we're there to partner with you in making those choices. Students can access syllabi to help their planning. And then you move into your second spring. You have some more, there's the recommended courses, but again, there may be other methods courses you want, maybe the spatial data methods, or maybe take a course in nutrition. So there's a lot of options. And then in your second summer, you have the last of the required courses, and these are required for everybody regardless of their program option, and this is the interdisciplinary seminar. And so that's the second time people come to campus, and this is where we cover public health ethics, and we get into negotiation skills, we do qualitative methods, so it's very interdisciplinary. And then you wrap up, you have, if you're kind of moving through with the 7 terms, you'll take a second summer 2 course, and then your final fall, you'll take your final courses. You'll also see that in that summer, so for people who are graduating in that third fall, you'll complete your applied practice experience, and Stephanie's going to talk about this. This is in partnership with our RISE office, but that's completed in your second to last term. And then in your final term, you will take our program's capstone, which is the comprehensive exam, and that's taken in your last semester. And so what you decide to kind of fill in these different spots is really based on what your goals are, and then in partnership as needed with our advising team. But yeah, this is just kind of I think an overview, high level view of the curriculum.
Yeah, so moving on, as I mentioned earlier, RISE. So who is the RISE office and what does that mean? So the RISE office is the Berkeley Public Health Careers and Leadership Office, and they essentially support students and alumni. So what's really nice about their services is you have them for life, and that is something that's very special here at Berkeley Public Health. But they support students in many different aspects. So clarifying goals, building your professional skills with you, and establishing connections. So 3 very specific buckets, which are public health practicum support. So starting early in the program, you'll have an opportunity to work on a practicum. And for those who have never heard of a practicum, it's very similar to an internship. It's field practice. We are taking in what you're learning, bringing in your public health training into something that is applied. So this can be remote, this can be hybrid, this can be fully in person. A lot of our students complete their practicum at their place of employment, but there's a lot of different types of practicums that students will do, and I'll fill you in the next slide with that. But in addition to this, there's career planning. So you might be at a stage in your life where you're pivoting, or you may be somebody that's been in the field for over 20 years. Wherever you're at, the RISE team is here to support you and meeting you, and whether this be mock interviews, whether this means updating your CV, there's a lot of opportunities for you to collaborate with them and utilize their services for the professional growth. And last but not least, as I mentioned, leadership development. So it's very important that we work with you to help ensure that you're strengthening your professional growth. So there's going to be different areas that they will work with you, and I think it is one of the most crucial parts in graduate school, because this is where you get to really apply your interests. A lot of times we're thinking about going to grad school, but do we have the opportunity to do things that help you facilitate some structured guidance? So next slide, please. I'm excited to talk about this actually. So with a practicum, I get this question a lot, like, what is a practicum? What does this mean? When can I start? So essentially the practicum, to give you a highlight, is a professional experience where students apply classroom skills, right? We don't want this to be something where we're talking at you. We really want you to build your skills. We want you to really strengthen them. And explore different areas that maybe you have not considered yet, or maybe dive into areas where you knew you're like, this is something that I came to build my skill sets in, and I'm going to do this through the practicum. So we want you to also, we encourage you to build your networks, and we'll do this through structured guidance. So the practicum will be supported through having a practicum consultant. So someone from the RISE team will support you with figuring out what you are interested in and working with you to figure out what you need to do to ensure your practicum meets our competencies, but it's also something that is going to be valuable to you as a public health professional. So you not only have a practicum consultant, but usually offsite you'll have a preceptor. So they will work with, they will be at the organization supporting you with the practicum. And the practicum consultant is somebody here at the School of Public Health, and they are going to guide you throughout the practicum process. And it's usually about 130 hours minimum. So keep in mind that, if you want to stay on a little bit longer to your practicum, by all means, but the minimum requirement is 130 hours. And finding it, is not going to be too hard because we have a system called Flex. So Flex is a platform, kind of like a job board. This is where preceptors are going to highlight postings when they are looking for students to fill for the practicum. The Flex system is really nice because we kind of leave that as a one-stop shop. You can look for jobs, you can look for practicums, you can check out many different opportunities through that. But one of the things that, or the questions that I also get is, how long is this 130 hours commitment? And on an average span, I would say it's about 3 to 4 months of commitment, but this can also vary from student to student. So just keep in mind that this is an overview. Sometimes practicums can be a lot longer if you're working on something that might require extra time and you're very invested in it. And some might hit that 130 mark. The location, as I mentioned, is going to be pretty flexible as well. So there's different opportunities for you to figure out what works best. Next slide, please.
Awesome. Thank you so much, Stephanie. So I'm going to go over our cost of attendance. We know that funding your degree is a really huge part of your decision and the decision-making process for graduate school. Right now, our cost of attendance is $1,629 per unit. Again, this is a 42-unit program. There's a few campus fees here, and some students ask, why are there campus fees if it's an online program? And we like to share that you are first and foremost a UC Berkeley student. So as a UC Berkeley student, you get access to all sorts of campus resources that are accessible online, and that's what that campus fee goes toward. Most of our students exclude SHIP, the Student Health Insurance Program, because they have health insurance through their employers. So with all of that taken into consideration, excluding SHIP, it brings the total cost of our program to just around $75,000. And how do our students fund their degrees? So some students do choose to self-fund the program because we're an online program and you are able to work full-time. Some students find that they are able to do that. If you are self-funding, there is a fee payment plan option, which helps break down those semester tuition fees into monthly installments. Many of our students, and I would say this is the most common approach for our students, they pay for, oh, I'm so sorry, my lighting is a little funky right now, but they'll pay for school through federal student aid. And that's essentially at the graduate level. It looks like unsubsidized student loans, but we encourage everyone to complete a FAFSA, even if you're not totally sure if you want to use financial aid. FAFSA is free to complete, and it essentially just gives you an assessment of what's accessible to you. We encourage everyone to check out public service loan forgiveness. This is something that changes frequently based on things happening at the federal level. So definitely, click on this link, learn a little bit more, but some students who work for a nonprofit or government organizations may be eligible for public service loan forgiveness. A big one that we encourage is to check if your employer offers any sort of tuition benefits. Many folks have a tuition reimbursement program as part of their overall benefits package. Definitely explore that. And then we also encourage you to check for outside scholarships. Lastly, we offer one internal scholarship, the Dean's Health Equity and Leadership Award, which covers roughly around $11,000. Diving into the admissions process. So I'm going to go through this really quickly, but I'm happy to answer questions. We do not use SOFIS. We just use what's called the UC Berkeley graduate application. UC Berkeley does have a minimum 3.0 GPA requirement, and we here at the online MPH, we have a prerequisite of statistics or college level math with a B+ or higher, and that's really to show quantitative preparation. We look at your advanced GPA, which is your GPA from your last 2 years of undergraduate. We require 2 essays, a statement of purpose and personal history statement, 3 letters of recommendation from either professional or academic sources. We do need to see transcripts from every institution you've attended, and your resume or CV showing your work experience. There is an application fee, and if you completed your undergraduate degree in a country where English was not the primary language, we will need to see English language proficiency in the form of an exam, either TOEFL or IELTS. And some really good news is that the GRE is optional, so don't worry about that. If you haven't already taken it, it's not something you need to take for our program. But if you did take it and you're happy with your score, you're welcome to send it our way. So we are accepting applications currently for our fall 2026 term. That's to start the program in August. We have 2 deadlines for this application cycle. Our priority deadline, which is January 5th, and we definitely encourage you to shoot for that deadline. You hear back much sooner. It's great for planning. And then a final deadline of March 2nd. If you're just starting your journey of considering an online MPH, we also have a spring term, and that deadline, which would be to start the program in January 2027, you can apply by August 2nd. And lastly, this is our contact information. So definitely feel free to reach out to us, especially if there's a question we don't get to today. We also have a couple upcoming sessions, so talking about how to secure letters of recommendation and diving a little deeper into practicum. So definitely get in touch with us. Stephanie and I are here to support your journey. That's our goal. We want it to be as straightforward for you as possible. Thank you so much. So let's go ahead and pause our recording and we'll open it up for questions.